All right, well, I think we might make a start. Good morning, everybody, and welcome to this Life Course Centre webinar. I'm Janine Baxter, and I'm Director of the Life Course Centre, the ARC Centre of Excellence for Children and Families over the Life Course. I'd like to start by acknowledging the traditional owners of all of the lands on which we meet and pay my respects to elders past and present. Today's webinar is one of two events that we have organised to coincide with Anti-Poverty Week. The Life Course Centre is a proud sponsor of Anti-Poverty Week, and this year it runs from the 11th to the 17th of October. And it's designed to raise awareness about poverty and to encourage action to end it. The theme of this year's event is Poverty Exists, Poverty Hurts Us All, and we can all do something about it. And of course, that message is particularly salient in 2020, given the circumstances relating to COVID-19, and of course, the impact of the pandemic on jobs, social connections, health outcomes, well-being, and the economy and society more broadly. And the Life Course Centre will be presenting two seminars this week, and the first is today, and they're both under the broad theme of families under extreme stress. So in today's event, we'll be hearing from Professor Karen Thorpe, one of the chief investigators in the Life Course Centre. Karen's also a professor in the Institute for Social Science Research at the University of Queensland. Karen is a psychologist, and her research examines the effect of early life course experiences and events on the social, learning and health trajectories of children across their life course. And her particular interest is early childcare and education environments, including parenting, parent work, the quality of care, education, and the early years workforce. And Karen will be focusing today in her talk on factors associated with meal provision in early care and education services. The work that she's presenting is joint with Dr. Sally Staten, who's also here today. Sally is an NHMRC Research Fellow, also here in the Institute for Social Science Research. And Sally has a strong interest in the role of children's early life experience on their lifespan development. And she focuses on the role of early childhood education in supporting children's learning, behaviour and health. So I'll hand over now to Karen, who will speak for about 35 to 40 minutes. There'll be about 15 minutes for questions and comments at the end. If you have questions, could you please type those into the chat box on your screen, and Sally will be monitoring those as we go forward and will chair the discussion at the end. And I'll come on briefly at the end just to tell you about the next webinar in a couple of days. Also note that today's session is going to be recorded, and it'll be available on the Life Course Centre website in a few days. So thank you very much, and I will hand over to Karen. Thanks, Karen.
Great, thank you. Thanks, Janine. Sorry for that technical hitch. I too would like to acknowledge the traditional custodians of the land on which all of us are meeting today, and acknowledge emerging and current elders, and particularly acknowledge the Turrbal and Jagera people of the land which I'm presenting. I'd also like to thank the Life Course Centre for the opportunity to undertake this work, and to acknowledge that this particular piece of work was funded by strategic grant within the Life Course Centre. Also to acknowledge my colleague, Professor Danielle Gallegos, who is who has been a critical friend on this work. Danielle is at the Centre for Children's Health Research at the Children's Hospital in Brisbane, at QUT, and at the Woolworths Centre for Child Health Nutrition. We've got 4 authors here today. 2 of us are nutrition and dietetics experts. The other 2 are Sally and I, who are developmental scientists, but we've also had a team of research assistants in this very intensive work. So I'd like to acknowledge Nicole Lakeman, Olivia Van Halen, Candace Oakes and Letitia Coles, who have made a considerable input. Janine has indicated that this presentation will be available. We've also submitted a working paper that will be available on the Life Course Centre website as well. So this, as I talk today, I won't be talking about particular references, but all of those can be accessed through the working paper that has been submitted. Okay, so what I'm presenting today is part of Mealtimes Matter, a larger project in which we have been looking at the issues of nutrition in families who live in circumstances of disadvantage. In the picture that you have in front of you, you will see two pictures. The first is taken as an image from the Great Depression, and the children here you will see are very underweight. And that was typical of the time. That the problem was not the quality of food, but the availability of food. Below we have a picture of a more recent, the more recent problem of poverty and food, and that is that food is available, but the appropriate nutrition is not available. And both of these are, both underweight and overweight are very important things for health and educational learning across the life course. Our first work in this Mealtimes Matter looked at families and food insecurity, and we were looking at the family food environment and the effects of the economic and resource circumstances of the family and how that interacted with children's eating. In that study, we found that we compared low-income families who were food insecure, who identified themselves as food insecure, and those who were not, and found that whilst families with fussy eating children in food secure families were able to provide different food, those in food insecure families did not, which can be a good strategy, except for the fact that what they did was restrict the type of food that was available to children so that there wasn't food wastage. So often that is foods that are non-core foods that are associated with obesity. So the second part, and that's what I'm talking about, the work I'm talking about today, is asking what role can the early childhood education and care sector play in supporting food security. And in this, we're looking at food provision and how early childhood education and care services support families. But I'm going to start with a confession, and that confession is the study I'm presenting today was never planned. It emerged right at the very beginning when we were trying to sample centres, early childhood centres that were located in low-income areas. When we were doing this, we used the My Child website as a source to look at food provision, so that we were trying to sample services that did and did not provide food in low-income areas. What we found was, as we were doing our sampling frame, that we had a lot of difficulty finding services providing food in our lowest income areas. So when we use a CEFA code, the lowest or the most disadvantaged areas were those where we really struggled to find centres that were providing food. Food was coming from home. And when we used AEDC, we found the same, that if we use AEDC as our sampling, the services where that's located in the most developmentally vulnerable small local areas were those that were unlikely to provide food. And that set us off on a path that wasn't planned, but turned out to be important, to look at what the market in early childhood education and care, and how that might make a difference to food provision. So I'm going to talk firstly then about what the opportunities are in early education and care, why this is important, and then I'll come to the food provision. So 96% of Australian children attend an early childhood education and care service at least for 1 year prior to school. The services that they attend are primarily centre-based daycare, which is the focus of the work we're doing and presenting today. or family daycare. Preschool services, which are often thought of as the most high quality, the standalone, are not where most children access early education and care. Often the preschool programs are embedded within centre-based daycare. That's what we had before. Lucy swapped it. Okay. The other important thing about this particular service setting is the amount of hours that children are attending these services, and at a time in the first 5 years of life that is critical to brain development, when 90% of our neural connections for life are made. If a child enters an early childhood education and care service in the first year of life, which many do, we have the child will attend for up to 10,000 hours, which is 2/3 of their total time they will spend in formal education. And so what we've got here is not only a wide extent of reach to children, but some children for whom this is a large part of their care provision. What that means for us is, of course, that early childhood education and care provides an opportunity. Those 10,000 hours are developmental opportunities for children. They're opportunities to promote health. And if we have the right policies and practices in place, they are also opportunities to redress inequities that we see in AEDC figures as children enter school. We see a wide disparity in children's developmental progress as they enter school. But it's complicated. Funding of early childhood education and care is not like the schooling sector. Early childhood education and care is a hybrid model of funding. It's in which there is a component of funding from parents. The majority of services run for profit. So services are funded by parents, the majority run for profit, and in low-income communities, of course, parents' ability to pay is constrained, even though we do have subsidies in place in Australia for early childhood education and care. Paired with that, we have the latest is the concern about food insecurity. So before I start, I'll just define what I mean by food insecurity using the Rome definition, which is its precarious access to sufficient, safe and nutritious food. And remember that first slide, it's about not just access to food, but nutritious food that meets dietary needs and food preferences to support an active, healthy life. The Food Bank report in Australia in 2018, looking at low-income communities in Australia, has suggested, we don't have very good national figures on food insecurity, so this is the source I'm using, is that 1 in 4 children are food insecure and that 1 in 6 are experiencing hunger. Now, the difference between those two is that what happens in families where there's food insecurity is that many of the parents go without food to enable children to have food. So they're living, 1 in 4 are living in food insecure families, 1 in 6 going hungry. The consequences of this for development are high. So there are indirect effects to parents. So it affects the family resource within the family, parenting stress that are associated with being able to meet family needs, the things that have led to food insecurity in the first place, and parent hunger, and that has effects on parenting. So these are indirect effects that will affect children because they're affecting the quality of the environment and the interaction environment in which they're living. There are also direct effects, of course, on the child, on their health, on their brain development, which is particularly important in the first 5 years where this work is focused, and on their learning capacity, with many studies showing that children experiencing food insecurity have poor concentration and poorer ability to regulate their emotion. What does this mean in terms of the long term, the life course? Well, as I showed in that first slide, there are effects because what we typically see now is overweight rather than underweight as a result of food insecurity, and the consequences are obesity, chronic disease, disability, welfare, dependency, and earlier deaths. In terms of development, early, particularly a recent study published from the United States pinpoints the toddler period, so from age 1 to 3, where food insecurity is associated with poorer neurodevelopment, poorer concentration, learning and behaviour, lower educational outcomes, and in the cumulative risk, poorer employment prospects. So the issue that we are addressing in this study is, can early childhood education and care, given its deep and wide reach, support food security? Educational sites, including early childhood education and care sites, are very good points for public health intervention. And we do see local examples of interventions that are effective. So, for example, food provision in schools, where we see breakfast programs, community support, where there's community gardens or school gardens that provide food for families, and parent education. There's also some really good work coming out of the United States from the Child and Adult Care Food Program, in which food is provided to, funding is provided in the form of a subsidy to early childhood providers, with the proviso that they provide high quality food and reduce fees to parents. What this particular program has shown is that the cost to the centre of providing high quality food is reduced. And as a consequence, children are receiving higher quality food than those who are in centres in similar locations that are not participating in this program. That the children meet all of their recommended guideline recommended dietary standards, and that the children's behaviour and learning is improved, particularly when there's an intervention in the toddler period. The other finding that has been published this year, looking at this particular program, is that there is not only an effect for the child within the childcare centre, but there's also a knock-on effect for the family of a reduction of food insecurity as a result of reduction in fees. In Australia, however, we don't have a similar program. There is the provision of food in ECEC is not compulsory. That leaves us with a number of problems. That going to an early childhood program firstly is not compulsory, and as I started, there's 4% of families are not accessing, and many more are not accessing beyond the year before school. And one of the findings that comes out of work that I've done for Queensland Government and a recent study by Marianne Fennick and Jen Scatterbowl in case studies of centres in low-income locations is that shame and the need to make special application for provision is something that prevents families from enrolling in early education and care services, or if they are attending, actually fronting. The Smith family's work currently being undertaken for the Department of Education, the Commonwealth, looking specifically at preschools, is also showing that effect. So, so stigma of poverty, and particularly of food insecurity, can prevent access. But even if families are accessing, there are no actionable policies to support families experiencing food insecurity within early childhood settings. The two policy documents that are relevant are the Get Up and Go guidelines, which talk about the ideal sorts of foods that children have, but don't specify that food should be provided by the service. That can come from home or from the service. And the other is the National Quality Standards for Early Childhood Education and Care in Australia. And again, what it does is specify what sort of foods one would expect, but does not specify that food should be provided. So, how are Australian services supporting communities at risk from food insecurity? What we have done, and I started by saying this was not an original intention, but what we ended up doing was mapping food provision for the whole state of Queensland, and looking at the associations of food provision against population indices of child health and development, looking at the socioeconomic characteristics of the communities in which those services providing and not providing are located, and then looking at how market competition for services affects the provision of food. So it's a correlational design study, looking at using a range of sets of administrative data that I list here. And in Queensland, we looked at the entire population of early childhood education and care services, 1,631 of those. So we looked at the My Child's website to look at fees, meal provision, market competition, and market competition was operationalised as the number of services per head of population at a small local area. We looked at child development, that should say AEDC, AEDI was its old name. We look at social disadvantage and also remoteness as indexes of disadvantage. And we also looked at whether there was some impact on the quality of provision using data from INSECURITY on the National Quality Standard. So what did we find? So firstly, let's look at general food provision. What we find is across the whole 1,600 odd services, that about half are providing food. But if you're in a city area, you're far more likely to get food provision. And what is least likely to be, the least likely meal that you will be provided is breakfast. But what we've got is about 50-50 of centres where children bring their food from home, or centres where there is provision made as part of the fee to attend. When we look at the correlation of this with AEDC vulnerability, what we find is there's not an association with any other meal except those 20% of services that provide breakfast. And in that case, it is much more likely that food will be provided, that breakfast will be provided in low income locations. So at the most disadvantaged areas, we'll see breakfast provision. And that association is statistically significant, and it is stronger in a metro area. But otherwise, we don't see a difference. What we do see is an association, however, with between food provision and fees. Not surprisingly, lower fees are associated with bringing meals from home rather than provision. And whilst it wasn't statistically significant, what we also see is a trend in which lower rating of quality on the National Quality Standard is associated with non-provision of food. But what we'll mark is that at the point is a trend within this sample that we have. So what about market composition? What do we find there? Well, here's the finding, and the first thing I think to note in this is that where there's low market competition, so where the number of services available per head of population are low, that only occurs in low income areas. So what we get is that that possibly talks to a concept that's being talked about very much in the United States of childcare deserts, where there's not provision and families are not accessing. That might be associated with not being employed, but the purpose, as we see, of early childhood education and care is not just enabling workforce participation of families, but also providing educational provision for children. So what we see here, the most notable first finding is this one that we see of only low income areas having, so this is our lowest CEFA, this is our highest CEFA, and this is our moderate CEFA codes. It's only in that low disadvantaged group that we see low market competition. When we come to moderate and high competition, we see a clear association between food provision and and market competition, and that the most sensitive group is this low-income disadvantaged group, that the provision in high competition is much more marked. So if you're in a high-income area, you're more likely to get food provision anyway, and the higher the market competition, we will see that. But this is an interaction effect in which we see far more. Now, why would that be? Well, one of the reasons that we believe that happens is, and if we go back to the recent study by Marianne Fennick and Jen Scatterbo, food, the provision of food and nappies are a really important thing to low-income families, and it is a market gainer for centres that do and don't provide services. If that's the difference, that will be the place that they will go. It's one less thing out of the household budget. But that begs the question, where are those costs offset? Because one of the things that we find in early childhood education and care, as I've already mentioned, is that these are constrained in low-income areas. So if they're providing food, and if they're providing nappies, then there will be something else that they're not providing. And our question is, what is that? Is it the quality of the food that they provide, or is it the quality of provision? And we see a trend there, but we don't see a statistical significant result at this point. So what we've got here is something that is, I think, worrying, but solvable. ECEC has the potential to support children and families who are at risk of experiencing food insecurity. And a strategy that's community-based is great, because people do go in and out of food insecurity. So if you've got children attending childcare services, long daycare services, it is a great place to intervene. In Australia, however, the market's operating such that children at highest risk are the least likely to receive food. So it's they're either not attending, or they are attending but not being given food in remote regional and areas where there is low market competition, with the exception of breakfast programs, where we see in some communities that's happening, but that's in 20% of services, not 100%. And market competition is increasing. So our question, and one of the things that we will be going on to do in the Life Course Centre 2020, is to look at where are the corners cut, what are the effects, and what we want to do is look at food quality. And we already have within this particular Life Course Centre project a master's student using a technique called EPAO, where we use photographs of the food that we have taken as we visit childcare centres, whether it's food that has come from home or it's food that is provided in centres, and we use that to quantify the amount and quality of the food that's provided. And we also are interested in generalised quality, which is the stuff our team does all the time, which is observing using standard measures to assess quality of provision, to ask what is happening. And asking that question, is there possibly a triple jeopardy for those children that are living in emotional and economic distress? And those, in terms of the quality of provision, the access and quality, and the food that they have, and their home environments. But I guess what I'd like to say is, beyond those community-based interventions to provide food, which we do see, is the policy actions and the systemic changes that might be much more important, that we would hope, once it's evident that this is happening, that we could do something about. Something along the lines of the United States program, the CAFCP program, where there's a social justice framing which removes stigma, and so it's not handouts, but a subsidy to those centres who are catering for the most in need. And coming back to the Flanagan-Scatterbolt paper, it was a deep study of 5 centres. This was what parents giving their voice saw as important, that affirmative policies that don't require special application are the ones where they will attend and their children will attend and get the benefits of long-term benefits of early childhood education and care. In terms of our own work, our next steps are analysis of the data of our intense observational studies of 10 services living in very economically challenged communities, and these are 5 providing food and 5 where they're brought from home. Abigail Stanley, our master's student, is almost about to submit her thesis looking at the quality of the food, and we have a Life Course Centre PhD student looking at feeding practices within the early childhood setting. Thank you, and we're now open for questions.
Thanks, Karen. If anyone would like to put up a question in the chat box, that's the easiest way to do it. I'll give people a minute to do that. Maybe while it's happening, I might just ask one of my own, Karen. Just in terms of, obviously I'm an author on this piece of work and familiar with it. It's been really interesting in terms of thinking about a new conceptualization of how we look at, sorry, random phone call, how we look at some of the drivers of practice in ECEC. Like often when we're looking at it, we're thinking about, training of educators, and we're thinking about, yes, SES will come into it, but I think often we're thinking about sort of the service level structures that are driving practices. And I'm just wondering if one could comment on sort of how this idea of looking at market competition could be quite useful moving forward, and also whether there's other areas of practice that might benefit from this kind of framing. Can you see it being used in kind of our understanding of practices more generally beyond food provision, which is what you've done here?
Yeah, sure. So obviously one of the things that we raise in this is food provision is what we were looking at, and we're looking at food insecurity, but it's a marker of many other things, and potentially an index of quality more generally. And so in terms of looking at market competition and its interplay with the socio-economic circumstances of the communities in which families are placed, and it's urban settings in low-income areas where we're seeing this strong market drive. These are places that, I guess there's a whole range of things. We do tend to focus when we look at quality and our national quality standards and our national quality framework for early childhood education and care, very much focus on the interaction between children and families in the environment. But they don't take account of those bigger contexts, and they certainly don't take account of market competition. Having said that, what we know is from the ECEC snapshots, the quality authority snapshots, are that that there are certain services that are under stress, and those are the family daycare services and the for-profits, who are much less likely than any of the other forms of provision, so groups that work not for profit, to A, provide things like food unless it's in a market competition, but B, one of the things where we, that I guess is my next port of call, is to look at the workforce, because what we see in those services that are working for profit, that are in high market competition, is that we're seeing pressure on staffing. So what you might see, for example, is a very good example, is staff being required to clean and children being required to lie down for up to 2 hours to sleep, so that staff can clean even if the children are not sleeping. And that means that if they're not sleeping, they're missing out on learning opportunities. They're just being made to lie down so that educators can mop. Now, these are not the things that when you're a developmental psychologist you really want to see. You want to see the quality of interactions, but nevertheless, unless you go into services and observe this, you can't see what's going on. And it's ultimately, the workforce is the quality. It's the quality of interaction. So they're the biggest predictor of how successful and how enduring early childhood education and care is for children's development when they enter school, but also their development right through into the secondary school period. So we need to look at this, and we need to consider, how do we support the for-profits if we're going to retain a mixed market in early childhood? How do we support them, and how do we decide who we support so that we're not choosing between whether we give them food or good quality education?
Thanks, Karen. So there's a question coming in here about looking at other models from other countries in the world. So, for example, Scandinavia, we often talk about Scandinavia as a model of ECEC, very, some interesting social context there, of course, and particular context. So, are there any particular models, and how do they perhaps contrast a little bit with what we have in Australia? And maybe you could talk about the US, because of course US is another model again.
Yeah, so Scandinavia is sort of held as the gold standard for early childhood. They have a very different population and a whole different sort of way of thinking about early childhood education as a public responsibility, not a private responsibility. So, so in terms of the whole way that early childhood education and care in Scandinavian countries is envisaged is as a public good. That is still probably a bit, we're still a bit ambivalent about that in this country, or a little bit, I've just recently written about the COVID-19 crisis and how nobody focused on this sector in terms of its educational loss. They focused on childcare, the childcare enabling parents to work. So I think Scandinavia is lovely, but it's not a good comparison. The United States is a good comparison, and the UK are a good comparison. They have similar mixed markets for their childcare. They have many for-profit operators. And I guess the best examples that we could find in writing the paper that will be on the working series is the one in the United States, where it's a subsidy to childcare services and Head Start programs that enable them to give good quality food, and they are inspected to make sure that they do, and to reduce fees. And that just is giving a provision free of stigma to families. And it works two ways. It incentivizes families to take their children to early childhood education and care. It reduces the food bill within the home, and therefore reduces food insecurity into the home space. And it delivers for the children in the long term. So that program is the subject of huge amounts of writing and analysis at the moment, but there's not any contrary findings that is not working extremely well. So it's systemic, but it's targeted. It's sort of a targeted universalism approach in which they put funding into particular services within communities rather than food handouts or money handouts to families themselves.
So another question that's come in here is really about the dynamics of food insecurity in relation to the pandemic that we're all living in. Are we seeing more or less food insecurity? Hypothetically, obviously, I'm not sure whether we've got the data, maybe you're aware of it. And how might this, I guess, be part of that broader social context that we're currently experiencing?
Sure, well, that's work in progress, and certainly we don't have data that we've analysed yet. We do have some data, and I think, again, this is a really good place for systems to look at systems. And the reason is that whilst the pandemic has put some families into under more financial stress, the families that are in this study that we've talked about today probably are less in financial stress because they have been receiving benefits that might put them above the poverty line. So I'm hoping that there will be a flurry of papers looking at the systems change, not only in our space, but many other places, because the COVID pandemic has actually shone a light on some huge inequities and some system changes that we can make. And I'll put a plug in because Janine is leading a paper with some of the senior people in the Life Course Centre on what COVID-19 has taught us and some of the policy and practice changes that could be made.
All right, can't work out which one of these, how to word which one. I'll give you two options here, Karen. They're both about sort of budgets and policies here in the sector.
Yep.
So one of these is, what would you ask Josh Frydenberg, referring the budget policies for ECEC, in relation to
yep.
the food question. And the other one is really what's the appetite in the sector around these issues, and what things are we seeing policy level, or are there, you know, is there an appetite to sort of think about how we better support food provision?
Sure. So I think what's very interesting is we've just come off a budget week, and the budget that was presented by Josh Frydenberg very much focused on infrastructure and not on social redistribution. But we had the next day Anthony Albanese come out and say, okay, well, we're going to give free childcare. Disappointing that he called it childcare, but what I think we've learnt through the pandemic is that early childhood education and care does two things, and particularly in terms of poverty. It enables people to get training and go to work, and particularly women who are living in circumstances such as being the sole head of household. It also, if and only if we provide high quality provision, provides great opportunity for the future and for economic recovery. But again, it's an if and only if. It doesn't do that. And there's now exceptional amount of research internationally, and the ECEC study that Colette Taylor and I ran showed very clearly that if the quality is not sufficient, it's not just access, it's quality, then you're not going to make the difference. So two things. One is, I think, you know, universal provision and seeing it as a public good, as the Norwegians do, might be a very big and important step for Australia, but not if we don't also think about the quality of what we're providing. And the quality of what we're providing is about the childcare workforce. And if we're talking about Anti-Poverty Week, many of the people who provide that service and are expected to provide love, care, and education to children are themselves living under huge financial stress. We did a very large study of the workforce and the stories of distress of some of the women working in childcare, particularly those who headed households, was one of huge financial and emotional distress. Just as parents who are living in those circumstances, and I presented that in today, are not optimal in their interactions with their children, nor are childcare educators, and so I think all roads lead to improving the circumstances of the childcare workforce.
Thanks. And then just there's a question here about data on service providers in Australia that are actually providing food, and what the quality of this is like. What do we see in practice? Because obviously there's provision of food, but there's also provision of high quality food. In the same way, there's provision of early education and care, and then there's provision of high quality early education. Sure.
So Sally, you might want to come in as a comment, not just asking the questions here. There's data available on food provision on the My Child website, which is a marketing piece in some ways for parents. They can go onto that site, look at provision in their local area, and look at what's provided for the fee and the fees. So it's, you know, it gives us data on that. What there's not very good data on is that held at a level for research. So we have had to extract data from the website to create a data set for Queensland. Hugely laborious, but we're trying to find ways to use data extractions that might be more efficient, but it's an extremely so the data quality at the moment is not as good as we would like. Sally and I both wrote the State of Early Learning report for Australia last year, and when that was tabled in Parliament House, we made a special shout out for better data sets. I don't know if you would like to comment, Sally, on the data sets.
Yes, I'll just agree with all that, I think. And yeah, I certainly, as Karen pointed out, the next step for us is also providing some data, of course, in a much smaller level, but data around what's actually provided in the services themselves, because that is a really important question. When we provide food, what is the quality of the food we're providing? And because, you know, unless we've got high quality food, we're not actually achieving the aims of that provision in this context.
Yeah, and anecdotally, when I was undertaking the workforce study, which was of 1,200 educators in Australia, and then with detailed studies of 100, when we were in services, particularly in the low income areas, what we saw was some children in non-providing services who came without food, and educators who themselves are living on the minimum wage, feeding children who did not have food, or those services held provisioned for that circumstance, but what they had was cheap. It was pot noodles. So, you know, it's and that's supplied not by the service, but by the educators themselves. So yeah, it's these are the things that we see when we're on the ground conducting our research.
And there's time just for one last question. This is really about educator-child interactions and what impact provision of food might be having on, you know, when you have a lunchbox versus, you know, food being provided. Are there differences? You know, you noted that we do have some work being done around that. Do we have any?
Yeah, we do, and we've got some results coming out, so that's nice. Our PhD student, Bonnie Searle, has been looking in detail at the quality of interactions between educators and children in the mealtimes. And what we see from Bonnie's work is that when meals come in from home, there's more pressure for the children to eat it. Now that we're still working with Bonnie on looking at why that might be, but we have two things that we think might be happening. One is that parents spend more than the amount of food that children want just so they don't go hungry is a possibility. And educators don't want them to waste food in that context of low income, so they pressure them to eat the food. The other sort of pressure is that when a food box comes in, there's a range of foods in there, and there's things like packets of tiny teddies, and the kids want to go to that first, and the educators say, no, you've got to eat the sandwich first or whatever. So there are all those sorts of dynamics that we see when children bring in their own food that we don't see when food's provided. It's standard food, and the healthy food will come out first, and the sweet food, whether it be fruit or yogurt or whatever, will come out second. So yeah, we see some differences. What that means, we've got a whole PhD to get through to understand in terms of what that means for children's nutrition, for children's development and well-being.
Yeah, and I think just to finish that, because I know that there's some stuff coming out there in Bonnie's work, but one of the things, you know, without you know, having looked too heavily into it, whilst food provision seems to avoid some of these negative coercion type behaviours, what we're seeing is less interaction, because of course the educators are much more preoccupied with the need to ensure health and safety, etc., because the onus is on them to make sure that everything the child eats is clean and healthy and safe for the child. So there's sort of, it's quite a complex area, I think.
Yeah, and that's where the National Quality Standard focuses on regulation. Yeah. So I think we're getting messages to wind up. So I'd say thank you very much. I'm sorry about the glitches that happened early, but I hope regardless that you could get the gist of what we're saying, and the paper is there for you if you're interested to read it. Thank you.
Thank you very much, Karen and Sally. And yes, apologies everyone for the glitches, but COVID-19 means that, you know, we're all learning new technology. So thanks for hanging in there. Thank you very much, Karen. That was really a terrific presentation. And just to reiterate, the paper that Karen has presented today will go up on our Life Course Centre working paper series, hopefully in the next few days or the couple of weeks. So have a look for it there if you want to read some of the results in more detail. So just in closing, I did want to remind people that we are presenting another webinar on Thursday. This one will be hosted by our Life Course Centre colleagues at the Melbourne Institute, under the same kind of theme of families under extreme stress. This one is titled Normal Stresses and Additional Challenges Arising from COVID-19, and it'll be a panel presenting with work coming from Dr. Dinah Bowman from Brotherhood of St. Lawrence, Dr. Matthew Curry from the Melbourne Institute and Brotherhood of St. Lawrence, Barbara Broadway from the Melbourne Institute, and Leah Rapana from University of Melbourne. So if you're interested, please sign up for that one. That's on Thursday at 11 AM Eastern Daylight Time. So just thank you to Karen and Sally and everybody. I hope you've enjoyed that, and look forward to seeing you again in a couple of days, hopefully. Thank you. Bye.